Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, drugs treating for hypertension. So, the group of drugs or the classification of all the drugs which are used in hypertension. First, we have first line drugs. In the first line drugs, we can use diuretics. First line drugs, diuretics are used like we can use thiazide. Diuretics are used like we have hydrochlorothiazide is used. Then we can use chlorthalidone can be used. Indapamide can be used. Then we have high ceiling diuretics. High ceiling diuretics are actually furosemide can be used. Then we have potassium sparing diuretics. In the potassium sparing diuretics, we can use spironolactone is used and amiloride can be used, which are potassium sparing diuretics. Then the one more first line diuretics is ACE inhibitors can be used. The ACE inhibitors are actually captopril, enalapril, lisinopril and perindopril, then ramipril, then fosinopril can be used. These are ACE inhibitors. We can also use angiotensin receptor blockers can be used. These angiotensin receptor blockers are actually losartan. Then we have candesartan and irbesartan, then valsartan or telmisartan can be given, which are any one of the drugs can be selected. These are ARBs. Then we have calcium channel blockers can be given like nifedipine, felodipine, amlodipine, nitrendipine, lacidipine. So these are calcium channel blockers which are given. So all these are the first line drugs which are diuretics, ACE inhibitors, ARBs and calcium channel blockers. Beta blockers are not the first line drugs according to JNC 8 criteria, so we do not write beta blockers here. Now the second line drugs. The second line agents or second line drugs include, first we have beta blockers. In the second line drugs we have beta blockers. Beta blockers are propranolol can be used, metoprolol can be used, or etinolol or carvedilol can be used. Then we have alpha plus beta blockers. Alpha plus beta blockers are also second line drugs which contains labetalol or carvedilol can be used. Then we have alpha adrenergic blockers. Alpha adrenergic blockers can be used. Alpha adrenergic blockers are prazosin can be used, terazosin and doxazosin can be used, and similarly phentolamine and phenoxybenzamine. Phentolamine, phenoxybenzamine can be used. Prazosin, terazosin, doxazosin, alfuzosin, phentolamine, and phenoxybenzamine are the alpha blockers which are used. These are second line drugs. Then we have central sympatholytics. Central sympatholytics are clonidine and methyl dopa are the central sympatholytics which are used. Then we have vasodilators. Vasodilators are actually arteriolar vasodilators, like we can use hydralazine is used with minoxidil is used and diazoxide. Diazoxide is used. These are arteriolar vasodilators. Then we have arteriolar plus venular vasodilators. These arteriolar and venular vasodilators are sodium nitroprusside can be used.
thank you and thank you for watching.